Good afternoon. My name is Marla McGuinness, and I will be your moderator for today's news conference. Before we begin, I'd like to introduce the Honourable Ian Rankin, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health. Go ahead, Premier.
Thank you. Before we talk about the case numbers today, I want to acknowledge that another family is grieving after their loved one passed away yesterday due to COVID complications. A woman in her 80s from the Central Zone. So on behalf of all Nova Scotians, I want to convey my condolences. We are very sorry for your loss. Today we are reporting only 4 new cases. That's a good day, Dr. Strang, and all of them can be traced. Our hospitalizations have come down as well, with 6 in hospital and 4 of those are in the ICU. I am grateful to our frontline workers who every day risk their lives to protect ours. And I want to thank you, Dr. Strang, and your team for your hard work in helping manage this 3rd wave. I know we aren't out of the woods yet, and the Delta variant is very worrisome, but these low case numbers are a very good sign. And I want to thank our vaccine team, who are working tirelessly around the clock to get needles in arms. As of this morning, 67% of our population has received their first dose. If you haven't had your first shot, please book one, and please book your second shot when you're scheduled to do so. It wasn't that long ago that we were looking at triple-digit case numbers and our hospital system under pressure. We are in much better shape, and I want to thank Nova Scotians. You have stayed away from your friends and family, you canceled plans, and you stuck close to home. Thank you for continuing to follow the public health guidelines and for adhering to restrictions. To our businesses and organizations, thank you for your patience. I know this hasn't been easy, and you've endured a lot. You helped us get through phase 1 of our reopening plan and get our active cases to below 100 at 97 today. Now we can start to enter phase 2 on schedule and safely. Today, our Minister of Inclusive Economic Growth announced some support for our hard-hit tourism sector. $18 million investment into that sector to kickstart our upcoming season. You can help too by taking the opportunity to travel your own province, do some sightseeing, and buy local. Soon you will start to see ads like this. It's been a difficult year, and half of our tourism operators, and we want one of our most important sectors to thrive again. That's why we are investing in the accommodation sector, and we are providing the restart money. In July and August, we will offer free admission to all of our provincial museums. It is our hope that when we can open up to tourists, our sector will be ready and visitors can enjoy a free day at one of our amazing museums. But rather than wait for visitors, we want Nova Scotians to enjoy your province. We live in the most beautiful and friendly province in the country, and we want you to rediscover Nova Scotia. You'll be able to do that now in this phase of the reopening. Restaurants can start serving indoors. Of course, outdoor service and takeout remains available, but you can now enjoy a meal inside and start to go to the gym again, opening at 50%. Start to go more and more to the retail operators that are now increasing capacity to 50%. Recognized businesses and organizations are permitted to start organizing outside and indoor events with restrictions. Long-term care residents can enjoy rec activities. And starting tomorrow, you can expand your friends and family social circle. 10 can gather indoors with 25 outdoors. So for those of you who have been away from family, tomorrow you can get that long-awaited hug. Enjoy your visits, and please try to get out into your province and enjoy and support your businesses, your main streets. Buy local. I know for some this phased approach may seem slow, but the Delta variant remains active in Canada, and we need to move at a cautious but deliberate pace. I said several times we would be flexible after that critical 2-week period of our reopening. And today you can start to see some of that flexibility. For those who have family and friends in our neighboring Atlantic provinces, we are thinking about you and want you to reignite with your loved ones as soon as possible. For businesses here at home, we want you to be able to welcome tourists. Opening to our Atlantic neighbors is the next big step. There has been a lot of discussion between the premiers, and our public health officials have had a number of conversations. This decision was not made lightly, but after much consideration, we believe we can open to our Atlantic neighbors on June 23rd. and it is the best alignment we were able to achieve in our discussions. This means that residents of New Brunswick, PEI, and Newfoundland and Labrador can safely travel around the region and will not be required to self-isolate when they enter into Nova Scotia. And I understand PEI and Newfoundland and Labrador confirmed to those states as well today. Our case numbers are down across the Atlantic provinces, and our vaccine coverage continues to go up. In fact, today, as I mentioned, we are at 67%. Some provinces track the percentage of people over the age of 12 that are eligible. We are past the 75% of 12 and up in this province. We need to keep that trend going, and we cannot let up, but we are doing well enough that next week we can enjoy traveling in and out of the Atlantic region. Dr. Strang, I'll turn it over to you for more details on the next phase of our reopening.
Thank you, Premier, and good afternoon, everybody. I too want to acknowledge that we have unfortunately have to report another death due to complications from COVID-19. I had to do that yesterday, and I offer my sincere condolences to the loved ones who are grieving. This is a reminder that while numbers look good lately, every case of COVID-19 can have devastating impacts. As the Premier said, travel within the Atlantic region will be back on June 23rd. Given case numbers and vaccine rates in the Atlantic provinces, I'm comfortable we can take this step safely. We're also moving into phase 2 of our reopening plan as of 8 a.m. tomorrow. Phase 2 travel restrictions and border measures will apply to anyone outside Nova Scotia coming to our province until June 23rd. And on that date, Phase 2 travel restrictions and border measures will no longer apply to people from New Brunswick, Prince Edward Island, and Newfoundland and Labrador coming to Nova Scotia. Those border restrictions will only apply to people entering from outside of Atlantic Canada. Our plan is based on 5 phases. The final phase will see at least 75% of Nova Scotians with 2 doses of vaccine, and which gives a high level of population protection from the virus and its variants. This is when we will be living with COVID-19. Each phase along the way will last 2 to 4 weeks, and the virus's incubation period is 2 weeks, and it is also the minimum length of time to assess the impact of changes in each phase. In deciding to move to the next phase, we continue to look at COVID-19 activity, hospitalizations, vaccination rates, and ongoing the rates of testing. And right now, all of these things are looking good. Cases are low, hospitalizations are declining substantially, and our testing, although we'd like it to be higher, is steady, and our vaccine coverage continues to increase substantively. Nova Scotians are working hard and we're making progress. So we need to celebrate that, but let's also stay cautious. We still have cases, and the Delta variant is starting to circulate more widely in other parts of Canada. England just announced that they are delaying their reopening for 4 weeks due to the Delta variant. Many of our new cases are in those not yet vaccinated or who are getting the virus within the first 2 weeks after their initial dose, before the vaccine has been able to take full effect. And so if you do get the vaccine and then develop COVID-19 symptoms, don't just assume that it may be a side effect from the vaccine. Please go and get tested like anybody else who has any kind of health symptoms. You can contract COVID-19 within 2 weeks of getting your first vaccine. The Premier and I have said repeatedly that testing remains key to our COVID response, and that will continue as we reopen. So again, we need everybody to build regular testing as part of their ongoing personal and family COVID protocols. I'm now going to share the highlights of Phase 2, but I'll remind people that all of the details are on the reopening section on our coronavirus website. So let's start with travel. Starting tomorrow, June 16th, our borders will open to everyone who wants to permanently move to Nova Scotia and those who are coming to a seasonal residence that they own. This does not yet include people coming to rented or leased seasonal residences like cottages or RVs at campsites. And for all these people, a 14-day quarantine is still required on arrival. We know that the border measures have been difficult on those who live away and have lost loved ones here. In phase 2, people can apply for exceptions to attend funerals for an immediate family member, and things will also be less restrictive for end-of-life situations. Now here's some more of the other key restrictions. Each phase will gradually increase gathering limits. So starting tomorrow, informal gatherings of up to 10 people are allowed indoors without distancing, and 25 people outdoors, again without distancing. And this applies to social gatherings with family and friends and informal community get-togethers and other events like weddings that are not hosted by a recognized business or organization. When a gathering like a funeral, wedding, arts performance, or a community event is hosted by a recognized business or organization, starting tomorrow, then they can have up to 75 people outdoors or 50% of the capacity to a maximum of 50 people indoors. And within these overall numbers, there can be small groups, 10 indoors and 25 outdoors, who do not need to physically distance, but there must be distance between the groups. This also applies to meetings and training, performances, and other events. This is a little different than originally planned in phase 2, but we've had some feedback from stakeholders, looked at our epidemiology, and I believe these additional steps are safe. Retail businesses can operate at 50% capacity with no limit on the number of shoppers per household that can shop. And restaurants and bars can resume operating indoors with the same conditions that are on patios. That is maximum capacity while still keeping 6 feet between people at different tables, and masks are required except when eating and drinking. Fitness, sport, and recreation facilities like gyms, yoga studios, pools, and arenas can operate at 50% capacity. The number for sports practices are increasing to 10 indoors and 25 outdoors without distancing, and we're making similar increases for arts and culture rehearsals. Libraries and museums can open at 25% capacity, as well as recreation and leisure businesses like dance classes, music lessons, escape rooms, and indoor play spaces. Children who are not yet school-aged will no longer have to wear masks at child care centers. And the final change I'll mention is for long-term care facilities, where we know restrictions have taken a toll on residents and those who love them. In phase 2, group activities and dining for immunized residents can resume, and activities like going for a walk off the grounds and using drive-thrus are again permitted. We're also allowing community-based programs for seniors and for people with disabilities to resume. These may seem like small steps, but will add up to spending a summer together safely. We want to keep moving forward, but right now that means slowly and cautiously, but with optimism about the future. I'd like to quickly mention about the vaccine booking page. Yesterday, we had to take it offline for a few hours. Inviting people to book second dose appointments sooner than expected meant we have had to reconfigure the entire booking system. Despite extensive testing, we had a few glitches that were fixed within 12 hours. I also need to ask that if you haven't been invited to book your second dose yet, please do not visit the vaccine to book appointments. And this was a significant problem yesterday as well. I know people want their second dose, and I'm glad about that. But your turn will come. As a reminder, people are being invited in the order that they were first vaccinated. So far, we've invited everyone who had a first dose up to and including April 25th. If you've been immunized since April 25th, you will get an email soon, but please wait until you get that email before you start using the vaccine, the booking site. Phase 2 brings us closer to our new normal. Restrictions and public health measures remain in place, and we need Nova Scotians to stick with us and the rules. Keep your social circles small and consistent, wear your masks, keep your distance, wash your hands, stay home if you're sick, get tested regularly, and most importantly, get your vaccine. It's incredibly important for everyone to get vaccinated. Without good uptake, public health measures and restrictions cannot be safely lifted. As of today, 67% of Nova Scotians have 1 or more doses, and we are closing in on our target of at least 75%. The vaccine gives us a way out of this pandemic. It gives us life without restrictions and the fear of getting sick or making someone else sick. It gives us a way to more easily be with loved ones again. So get your vaccine, both doses, as soon as you can. The sooner you do, the sooner we get to our new normal.
Thank you. We will now take one question and one follow-up from media in the amount of time that we have. We will begin with Preston Mulligan with CBC. Go ahead, Preston. Preston, are you there? Okay, we'll come back to you. We'll go now to Sarah Plowman with CTV. Go ahead, Sarah.
Good afternoon. I'm wondering, while a lot of people are thrilled, really, that the Atlantic bubble will be happening earlier than expected, others might also question why not just move on to phase 3 now. I'd like to ask that.
Yeah, go ahead.
So each phase, the opening the border is one component. So as we open up the border, we do take on some more risk. The other components, gatherings, all those other things, we need to stick with the minimum 2 weeks as we incrementally open up all those other components that are part of each phase. We have to be careful about how much risk we take on at any one time, and then give ourselves enough time to monitor the impact of that increased level of risk.
Sarah, do you have a follow-up question?
Yeah, speaking about vaccinations, I just want to clarify sort of, so it's 67% of the population has received their first or second dose, but only 61%, 61.4 have received their first dose. Is that correct?
No. There's 67% have one or more doses. There's a small percentage of that have had both doses.
Okay, we'll move now to Jesse Thomas with Global. Go ahead, Jesse.
Thank you. The question is regarding the June 23rd date, and just wondering what factors were at play to bump that up. I think a lot of people are excited about that. But at the same time, I'm wondering how much work in consultation went on with other jurisdictions and their public health to find a date and make sure that it essentially jives.
Yeah, I've been talking to my counterparts daily over the last week, trying to find a date that would be as closely aligned as possible to give certainty to people booking their trips, tourism, and families that want to reunite. So this is as close as we've been able to come with 3 provinces on the same date, but New Brunswick is sticking to a plan that they've set out. And we may still all end up on the 23rd if I understand the next phase could be reached before the 23rd. So we are still really close, but it took a lot of conversations to find a mutually agreed upon date that we could confirm today.
Jesse, do you have a follow-up question?
Thank you very much. We've heard the Delta variant mentioned a few times, and it's something we have to keep our eyes open for. I guess as we see case numbers continue to decrease here, are we still maybe treating these cases as potential variants, or how do we handle it with the Delta variant, Dr. Strang? I'm wondering how soon we can identify which cases are, in fact, the Delta variant as they come in.
So we continue to do surveillance at our lab, screening for variants, and then sending specimens off to the national lab. So far, we have not identified any additional Delta variant cases beyond the 2 that we had and we talked about at the last briefing. But we continue to watch for that. We do know that the Delta variant is becoming more common in other parts of the country and is quickly, in terms of the percentage of overall cases that are the Delta variant, is quickly growing. So that's why we have to be still cautious, especially as people come into Nova Scotia from other parts of the country and internationally. The key is that we know that 2 doses of vaccine is necessary to provide good protection against the Delta variant. You need not just 1, and so we need to remain cautious, especially until we build up a sufficient level of Nova Scotians with 2 doses of vaccine.
Let's jump back to Preston Mulligan. Preston, are you there?
Hey, yeah, thank you, Marla. My first question is about the state of emergency. If Dr. Strang or the Premier could walk us through what targets and what sort of metrics are you considering to get us out of the state of emergency and what changes that would entail.
Yeah, so they're extended every 2 weeks, and we'll continuously look at. I think a lot of it is border protection, and then other measures that we have to have in place. So I would say that we would visit that sometime in Phase 5.
Preston, do you have a follow-up question?
Yeah, quickly. What will Nova Scotia's plan be? What will our plan be if New Brunswick opens up to the rest of Canada before we do? How will we? What will the border screening look like? How will we do that?
That's the work that's underway with our departments of Service Nova Scotia and our IT groups and border control. We're continuously looking at how we have some system in place to validate vaccines. Other provinces have some certain requirements. Even Prince Edward Island's asking for one vaccine with the Atlantic opening. So that work is underway, and without knowing exactly when New Brunswick will open to Canada, we won't know exactly how we'll determine our next steps, but we'll ensure that we keep Nova Scotians safe and we won't take any undue risks.
Next, we'll go to Keith Doucette with the Canadian Press. Go ahead, Keith.
Yes, Premier, I'll ask you about New Brunswick. Why is it that we couldn't get them on board with the rest? It seems to me that it would be better for everybody to coordinate with the same date. And does this actually throw into question whether we might see another outbreak because somehow we haven't been able to get our act together as 4 provinces as opposed to 3?
Well, the epidemiology in Atlantic Canada is similar in each province, and that seems to be a more cautious approach than looking at the rest of the country. So it is our hope that all provinces let the Atlantic region travel for a little while before any of us start to open up to the rest of the country. And we will have much broader uptake with second doses towards late June going into July. So that could change things together with our better border control. So we all have different, I think, teams that we try to have as many conversations as we possibly can to ensure that we're as aligned as possible. But ultimately, different provinces will make their own determination.
Keith, do you have a follow-up question?
But do you consider it essential that you at least be together when you open up to the rest of Canada? It seems right now that New Brunswick may well do it by July 1st, and you're still talking about July 14th. What's your stance on that? Do you think it's important that all 4 be on the same page at least when we open to the rest of Canada?
Ideally, that's what I would like to see, all 4 provinces in the same place. Right now, we're very close to being aligned on the Atlantic side of things, and we'll continuously have I'll continue to push for regional cooperation throughout the course of our phases.
Next, we'll go to John McPhee with the Chronicle Herald. Go ahead, John.
Thank you. Dr. Strang, given the lack of cases in the 3rd wave in long-term care, what is the rationale for going so slowly and easing restrictions in that sector, such as allowing residents out for visits, particularly people who are fully vaccinated?
So, like everything, we need to be slow and cautious, especially those who are most vulnerable to severe disease. And also, we know typically, even though they've got 2 doses, they're the ones that most likely are going to have a suboptimal response to the vaccine. We know the impact of COVID in the long-term care sector. We don't need to look anywhere else outside of Nova Scotia to know that from our first wave. So we will continue to make it a priority to, while we define that appropriate balance, keeping our seniors and long-term care facilities safe while we slowly open up and give more social and other opportunities for that important connection with each other, but it must be done safely.
John, do you have a follow-up question?
Yes, this is also for Dr. Strang, and it's about community spread. The cases today, none of them are under investigation. Now, in recent days, there have been still, like the sources of the infections had not been tracked down. I'm just wondering if you could characterize the community spread that still exists in the central zone.
We've had a number of cases over the last several days where there have been, at least initially, we put them source unknown. One day does not mean that all goes away. We are always looking at patterns of things over time. I'm encouraged by today, a number of 4, and all of them explainable, but I certainly would need to see that trend sustaining for many more days before we could conclusively say that there is no longer any signs of community transmission anywhere in Nova Scotia.
Next, we'll go to Lindsay Armstrong with All Nova Scotia. Go ahead, Lindsay.
Thank you. A question for the Premier. Given today's Atlantic bubble announcement, this being a substantial change from the original five-phase plan we were shown, I'm wondering what further changes we can expect in phases 3 and 4.
Well, I don't think it is a substantial change. We're advancing the Atlantic piece of Phase 3 1 week earlier. That was based on conversations that I had to try to get to a consistent date with our neighboring provinces. We do want to see 2-week periods of separation as we start to open up the province.
Lindsay, do you have a follow-up question?
Yes, I do. Thank you for that, Premier. On that note, I'm wondering if you are considering further shortening phases, particularly in reference to opening up to the rest of Canada. Today's press release, the line said we are on track to open to Canada by no later than July 14th. That seems to suggest that it might happen sooner. Are you looking at speeding along that stage of reopening?
It could. We're looking at trying to provide certainty. If those people want to travel into Nova Scotia from beyond Atlantic, we wanted to provide a date that they could count on. So July 14th was as comfortable as we can be today. We're starting with the Atlantic. We think that's the cautious approach to start with. But we may have more systems in place to validate the vaccines, and we'll have more vaccine uptake here. The second dose especially, we need to ensure that we have better coverage here to combat potential Delta variants that could come in.
Next, we'll go to Adrian Blanc with Radio Canada. Go ahead, Adrian.
Good afternoon. I understand that Atlantic Canadians do not need to be tested or show proof of a first dose after June 23rd to come into Nova Scotia. Could you explain what led to this decision?
It was together with talks with my counterparts and our comfort from our chief medical health officers in each province that made those determinations. So again, we had June 30th as a date prior to. PEI was the 27th, and we talked about a date earlier on that we could all be in agreement with, and most of us agreed the 23rd was the right date.
Adrian, do you have a follow-up question?
Yes, you explained, Premier, that you are looking at having a way of having a reliable proof of vaccination. Could you give us a timeline of when we could see that put in place, and why is it taking so long? What is it making it take so long? Yeah.
There's different provinces are working on different approaches to this, and not everybody uses the same system. We have the Can Immunize, so ideally everyone would be on the exact same system, and we would have it all consistent across the country. But we recognize that we have to have something in place so that we don't just have 100% trust that people are, what they're saying they have at a border is indeed the truth. This is about mitigation of risks, and as we continue to develop a system, we'll have the Atlantic open, and we hope to be open in July, and ideally early July for the rest of Canada.
Next, we'll go to Daryl Cole with the Amherst News. Go ahead, Daryl.
Good afternoon. My question is for the Premier. With New Brunswick reaching the 75% threshold of first dose vaccination, it's opening up the province to Cumberland County residents without the need to isolate. I'm just wondering, when Cumberland County residents go into New Brunswick, when they return to Nova Scotia, are they going to need to isolate for 14 days?
They will have to self-isolate until the June 23rd.
Daryl, do you have a follow-up question?
So there's no change to Nova Scotia's policy then?
No, we have the epidemiology in Nova Scotia that, as I said, we have a policy for our province, and New Brunswick went ahead with a piece of our province, and that's their decision to make.
We've developed for, it's called a New Brunswick PEI Nova Scotia travel protocol, which lays out requirements that people who have to travel regularly for school, for work, child custody reasons, they don't have to do the full 14-day quarantine, but they do have to follow certain requirements. That's all on our coronavirus website. That is not going to change. It's been in place for a significant period of time. So the requirements for Nova Scotians won't change until we hit the 23rd, but I just wanted to make sure people are aware that there's lots of people travel on a regular basis, and there's well-established protocols that they'll continue to follow.
Next, we'll go to Tim Bousquet with the Halifax Examiner. Go ahead, Tim.
Hi, good afternoon. Dr. Strang, there's still concern about school cases, and there seems to be a lot of chatter today about 2 new cases coming out today in the Halifax area, and the suggestion, and I don't know how true it is or not, that one or both of yesterday's cases was announced at the wrong school. Do you have any clarification on that?
Yeah, we had 2 cases which were released last night, and we clarified with their incorrect school. We clarified it this morning that they're related to St. Joseph's A. McKay School. We weren't able to, because late last night, we wanted to make sure, get information out, but we weren't able to do all the validation steps, so we apologize for that error.
Tim, do you have a follow-up question?
Okay, that's helpful, thanks. I just wanted to know how it's going with the testing at the airport. It's been about a week, I think, and my recollection is that there's been 2 potential exposure warnings for flights since then. Were they identified through the testing at the airport, or were they identified after the fact?
I don't have the details. It could be either. Sometimes we have people who may test negative initially when they arrive, and then later on test positive. So, and then we would have identified potentially that they'd been on a flight while they were still infectious. So, without looking into each detailed case, I can't tell you exactly where their testing was done. In general, I'm hearing that the testing at the airport is going very well. There's a high uptake for that testing, and we're working out some of the initial kinks, if you will, that you have in any protocol when you first roll it out. But overall, it seems to be going very well.
We'll go next to Victoria Walton with The Coast. Go ahead, Victoria.
Thanks. Dr. Strang, with the reopening or with the Atlantic bubble, people being able to come here, and with testing being widely available in Nova Scotia, but not really mandatory, do you recommend, if people are coming to the Halifax area, if they should get a rapid test, get a PCR test before, meeting up with their friends and family that they're visiting here?
We'd certainly recommend, whether it's people traveling within Nova Scotia or people from Atlantic Canada traveling here, or Nova Scotians who have been traveling elsewhere and then coming back. Everybody building regular testing into your kind of COVID protocols, especially just before or after you've been visiting, maybe in a larger social setting when you've been around lots of other people. Always a good idea. And certainly our testing, or whether it's pop-up sites or our PACs, and are available for people, even though travelers who are here in the province temporarily.
Victoria, do you have a follow-up question?
Thanks. And Premier Rankin, I'm wondering, the Emergency Measures Act, you said we might be able to end as early, or in phase 5, but that also does end some other protections for renters, for businesses with taxes. Is there any thought to extending some of those programs, even if, the rental program is set to extend till when the EMO ends, or I believe January of next year? Is there any thought to extending it through to January, even if we come out of COVID early?
Yeah, there's some thought that has to go into a lot of those programs that have certain protection for renters and that waive various fees for businesses that we were able to do to make life easier for Nova Scotians. So we'll do that, and we won't be in a rush to remove the act until it's necessary to do so. So phase 5 is when we start to look at the full grand reopening with separation requirements being alleviated and masks probably not being mandatory. So we're not close to being there yet. Certainly not. We're not going to be there. I don't see this summer, but once we get to a point where we're in phase 5, we can start to think about what measures make sense to keep in place.
We'll go next to Pat Healy with the Laker. Go ahead, Pat.
Hello, this question is for Dr. Strang and Premier Rankin. With the daily numbers of tests decreasing, how is Nova Scotia able to justify moving to phase 2 and ensure that this will not backfire? I have seen people posting online to other people to stop getting tested so our numbers will be low.
So that's unfortunate. That's happening. We keep messaging here at these briefings through our social media, encouraging all Nova Scotians to get tested. We're still doing, several thousand people a day. It's important we continue to do that. Our test volume is only one piece of information that we look out. Our percent positive of our tests is very, we're now for several days we've been at 0.2%. So of all the tests we're doing, only 0.2% of them are positive. That's an important piece of information. We look at our cases that we're seeing and the average number of contacts per case, and the cases that are that we can't explain or unknown acquisition. All those pieces, everything is pointing in the right direction, and we feel is very safe. We need to continue those trends, but certainly we're at a place where it's safe enough to go to phase 2, and our epidemiology plus the epidemiology in the other Atlantic provinces allows us to open up for travel within Atlantic Canada in a week's time.
Pat, do you have a follow-up question?
Yes, I do. Also for Dr. Strang. Parents have messaged me asking how it's safe for us to open up to Atlantic Canada on June 23rd, but not allow graduation ceremonies to go ahead, or limiting how many people can attend them. What's your response to them?
So it's all about different activities. We're not saying no to graduation, community celebrations of graduation. We're just saying that they have to happen within whatever requirements for gatherings and special events are in place at the time. We'll be able to have larger gatherings once we get into July or even August. There's nothing that says that a community group couldn't wait until July or August and be able to have the type of celebration they want to have. But if they want to go ahead here in June in phase 2, then they have to live within the restrictions which we announced today. So limited numbers of people getting together for special events.
And that's all the time we have today for questions. Go ahead, Premier.
Thank you. And before I provide concluding remarks, I just want to play a short clip of our Tourism Restart Package support program.
Here's to the ones that stick close to home. Because we're not unadventurous. We just know how much adventure can be found in our own backyard. And we're not afraid of new flavors or experiences or exploring the world. We just know there's a whole world to be explored right here in Nova Scotia. Some people might call us homebodies. To that we say, what a home it is.
So tomorrow is a big day. Our businesses will open a little wider, and they need your support. So go to a restaurant, take in a workout at your local gym, or stop by a retail shop now so they can support so you can support more customers that they're allowed in. It's been a difficult time for businesses, and I want to thank all the owners and operators throughout our province for their patience. As we open up a little more, let's remind ourselves to think local, support local, and buy local. Our support for local businesses can go a long way. It's also a big day for family and friends who have been apart for nearly 2 months. They can now reunite in person. Seniors can see their children, grandchildren. Grandmas and grandpas can visit their grandchildren. A dinner of 10 inside is now possible, and a gathering of 25 outside can be even better. Families come in all shapes and sizes, but what's most important is they come together in love. So start making plans to see one another And instead of a virtual hug, enjoy the real thing. It's so much better.